My name is Joanne Pong, and I'm a chronic pain specialist. I own Manual Physical Therapy, and Dr. Myra and I work together to specialize in helping people who have been in pain for many years, have tried most everything: narcotics, surgeries, multiple injections, chiropractic, acupuncture, exercise, massage, and yet they are still dealing with pain. Today's workshop is about failed surgery. Failed surgery, usually we blame the surgeon for having not done their job, because when people have surgery, they are expecting that there should be some significant relief. And then they feel like they've been let down because they're still hurting. And so I want to discuss about why, even after surgery, there's still pain, and that more often than not, it's not because of what the surgeon did or didn't do. Rather, it's a fact that you have been compensating for years before you did your surgery. So, who is this for? So, this is for people, like I said, who have had the surgery, but the pain never went away. If you've had multiple surgeries and you're still searching for answers because it didn't give you the relief that you were looking for, if you're trying to avoid surgery and want to know what other options you have out there so that you can avoid it, and for those people who have tried most everything and found nothing that worked, this is a workshop for you. So I'm going to tell you my backstory. So why is it that I decided to specialize in chronic pain? So it goes way back to when my younger daughter, Jules, who is now 22 years old, she was born 3 months early, and because of that, she had a bleed in her brain. And when she did, she ended up with cerebral palsy, which essentially means birth injury. So I knew that she was going to have some disability. So my focus had always been, how could I minimize the disability so that she will grow up to be independent? So that was the goal. And when I started doing therapy with her, there was an aha moment, which was, yes, there were symptoms and presentation of the neurological deficits, but it also occurred to me, what if she was compensating for the neurological deficits? And what if I address those deficits? And so when I started looking at her problem differently, it allowed her to become a lot more independent than was expected of her. And so currently, you can see that in that picture, she was using a walker. She had surgery then, but you can see that in the other picture, she was hiking mountains in Taiwan. So that's how independent she has become. And so when I started looking at the problem differently, um, it occurred to me, I can do that with chronic pain. So people live in pain, and so they're compensating in order to minimize the pain. And I thought I can also solve the compensations the way I did Jules. And so that is what led me to a very unique approach. Patients tell us it's revolutionary, and it really is. And it is called body recalibration method. And there are two types. One is fascial recalibration, um, which means that you untwist the fascia, because when you are compensating from living life in pain, you inadvertently twist that. So we do a treatment where we untwist it and you should feel better. And then the other one is muscle recalibration. So we are going to talk now about what can you recognize in yourself that will give you hope that there is a possibility that your surgery was actually successful, as long as you address these problems that you're about to recognize? Okay, so like I said, after surgery, if you feel like you have had a failed one because you're still in pain, I believe that the missing piece is that you still have the lopsidedness that have resulted from living in pain. Because when you start compensating, and if you do that for years on end, you will eventually become lopsided. And so if you don't address that, over time, your body will no longer be capable of the movements required to walk, to sleep, to stand, to sit, those things that you truly want. So the message I want you to consider is, if this is your situation, stop treating your diagnosis. People tend to be obsessed about their diagnosis, the pinched nerve, herniated disc, bone on bone. I want you to think for a second, what if you change the approach? What if instead of obsessing over the diagnosis, you are going to address the compensations? Because believe me when I say this, in chronic pain, your problem is beyond the diagnosis. Einstein had this saying where he defined insanity as this: insanity is when you're doing the same thing over and over and you're expecting different results. So if you are one of those that have had multiple surgeries thinking that that's going to solve the problem, if you have tried multiple injections, if you have tried taking narcotics for years and nothing has really changed, I believe that if you look at solving the problem from this perspective, you're going to find out that this is your solution. So I hope that you will consider looking at your problem from this perspective. So when people come to us and they say they want pain relief, my question to them is always, is that really and truly what you want, is pain relief? And I actually don't believe that that's what you want. What you want to do is to regain the ability to travel, the ability to play golf or tennis, to work and not be in pain, to be able to sleep through the night, to stop planning life around your pain. I hear that a lot from patients. Another goal that you truly want is to stop relying on pills, surgeries, or repeated trips to the doctor. Another one that I hear is that you truly want to reclaim who you were before your pain took over. Who were you as a wife or as a husband or as a friend before the pain took over? Once people get the relief that they're looking for, it is not unusual for us to hear from our patients who say, you know what, my friend says I am back to my old self. So in other words, from living in pain, you've kind of lost that identity that you used to have, the fun self, or the one that was adventurous. And so people really want to get that back. And then the other one, this is actually one of the biggest problems, the biggest fear that people have is they worry, will the pain ever go away? The thought of the pain being there for the rest of their life, that is very scary. So that is really what you want, is to stop worrying about, will the pain ever go away? And then the other one is to know that your pain is not all in your head. You're not just looking for attention. It's real, and that you want to be believed, because a lot of times friends and family kind of like shrug it off and question it. Even doctors sometimes make it sound like it's in your head, that people sometimes think, are they crazy for thinking that they have pain? Do they really have pain? And my answer to that is a lot of times, yes, you do have the pain. The unfortunate thing is no one can see that. And so sometimes your friends and family will question it. So let's talk about body recalibration method, because this will make sense as I go further. So what body recalibration does is it does what it says. It recalibrates the body. So how? There are 8 ways that we recalibrate the body. One is myofascial lines. The other one is recognizing that you have a sacral instability. The other one is rib cage rotation and tilt, pelvic rotation and tilt, trunk tilt or hip shift, pelvic stability, weight-bearing asymmetries, and biomechanical pain. So we're going to go over each one of them, and that will allow you to assess yourself. Do you have these problems? Because if you do, that should give you hope that if you address those issues, there is hope that you can regain your active lifestyle. Okay. So let's start with the first one, myofascial lines. So myofascial lines are specific muscles that overlap. They're kind of like a train that they overlap, and there's specific there's specific patterns to it. And so there's actually 8 different lines or patterns. There are only 206 bones in the body. There are well over 600 muscles. So 206 versus 600. So if you think about it, there's a lot more muscles than bones. And what you also have to remember is that muscles move bones. It's not the other way around. And so when you look at it from that perspective, when you become lopsided, then you realize that it's the muscles that have become tight that moved it and made you off kilter. So the myofascial lines are that's how we sort of base what problems you have. So essentially, it's almost like our, the guide to recalibrating the body, essentially. Okay. So the second thing that we look for is called rib cage asymmetry. So I want you to look at yourself in the mirror. Does it look to you that one shoulder is higher than the other? And if you look down at your chest, does it seem to you that one breast seems a little bit larger than the other? Or for men, is one of the chest, does it seem thicker compared to the other? What is that telling us? So if your rib cage is tilted, you'll notice that one shoulder will be higher than the other. If your rib cage is rotated, when you look down, because you're rotated, so from here, if you're rotated like that, then of course this breast will look bigger than the other. So it doesn't mean it is. It is one way of looking at a problem that tells you you are asymmetrical or lopsided. Now we move on to pelvic rotation. So here, I want you to march in place 3 times, and then don't move your feet and look down at your feet. Does it seem to you that one foot is ever so slightly ahead of the other? Does it look to you that one foot is ever so slightly pointing outward compared to the other? So what does it mean? It means that your pelvis is actually rotated towards the foot that is pointing out. Okay. And if you are rotated to the right, for example, then of course your left foot would be slightly ahead of the other. Now, there are certain situations where you would notice that things are inconsistent. In other words, the foot that is slightly ahead will be the one that's turned out. That will tell us that your body is twisted like a DNA. And that's what we call, if you remember the fascia lines, that's what we call the spiral line problem. So there is still a solution to that. We just look at the problem differently. Okay, the next one. This is another way of finding whether your pelvis is rotated or not. So you sit like a figure 4 position. And when you do that, you look at the height of your knee. Is one knee slightly higher than the other? And that tells you if the one that's lower, your pelvis is facing in that direction. Okay, so that's what that means. So you're not really testing the knee, you are testing the position of the pelvis. Now, now we're going to go to the trunk shift, or I'm sorry, the trunk tilt or the hip shift. So when seated, you will see that you know, when they're seated, the chair that the patients were sitting on happen to have those holes in the back that really highlights what the problem is. And so in this particular case, both of them, their trunk were actually leaning towards the left. Okay, so you can see the holes are more visible on the right side. So that's one of the ways to do it. So just sit in a chair, have somebody take a picture of you, and see if you can see more of the back of the chair on one side compared to the other. That's an easy test to do. Here's another one to test whether you have a hip shift. And that is, while you are standing, is there a wider gap on one side compared to the other? And you'll notice that because sometimes you can actually feel that your arm is touching the hip more. So in other words, if my hip is shifted to the right, I will feel the hip on the right side more than the other side. So those are easy ways to tell you that your body is shifted. Okay. All right, pelvic instability. The way to test this is to simply stand on one leg. Okay. Now in the picture, you'll notice that when she stood on the left leg, her body leaned more to the side. And then when she stood on the right side, she didn't lean so much. So why is this significant? No one really stands on one leg. It is very significant when walking, because as you walk, when you advance one foot ahead of the other, for a split second, you're actually standing on one leg, right? So as you move one foot, you stand on the other, and then you stand on the other. So if you have this type of problem where you lean more on one side, but not so much on the other side, essentially what that means is that when you're walking, you are going to tip more to the left like this, right? That's what the presentation is going to be. And so if you're looking at root cause, there's these people who say, I don't understand. Most of my pain is on the left side, or most of my pain is on the right side. Well, this is a classic problem that can explain a lot of that. Because if you are going to tip more to the left, guess what? You are abusing the left leg because you are tipping towards that direction. You are tightening this because you are constantly tipping that way. And on the other side, you're actually overstretching them. Okay. An overstretched side can also have a problem. And so in situations like this, if you're going to do stretching, you have to know which side needs stretching. So if you stand on this side, then you will benefit from stretching on this side. But on this side, this is actually overstretched. So you don't necessarily want to stretch an overstretched side. So that's why it's very critical to understand which side needs stretching and which sides don't. you probably hear of people who say, I'm trying to stretch all the time. It's not helping. Very likely you are stretching the overstretched side. So you are unaware of it, that you are actually making the problem worse. So, all right, next one, weight-bearing asymmetries. Okay, so this is an easy, if you look at the picture, this is an easy way to know that your weight bearing is asymmetrical. Usually one foot will behave differently than the other. But you can also simply test by standing on both legs, okay? And just pay attention. Does it seem to you that you are putting more weight on one leg compared to the other? People don't realize that because no one ever asked that question. But if you stand on both legs and you happen to notice that you are putting more weight on one leg, then you are also going to overuse that leg. Now, an explanation that I often hear, especially with surgery, is, well, I had a hip surgery on the right side, and so that is why I am putting more weight on the left, because I'm trying to favor that side. I get that, right? That is why you became lopsided. And so after surgery, it's time to correct that, okay? And then I want you to pay attention to weight bearing when you're sitting. You are going to notice that as you sit there and pay attention to how there's pressure on your buttocks, you're also going to notice that one buttock seems to have more pressure. It seems to be touching the chair more. And then the other one isn't, or it just seems like a smaller area is touching it. When you're lying down, you are also going to notice, if you're lying down flat, that one buttock is actually touching the bed more compared to the other. The rib cage, you'll also notice that one part of your rib cage, one side of it, is touching more than the other. A lot of times you'll notice that this is touching more and the bottom is touching more. That's the more common one. That means that the body is actually turned to the right. So when you're laid down, there's more pressure on this side. But if you're the kind that based on fascial lines, you have the spiral line, you are also going to notice that, oh, wait a minute, when I'm lying down, this side has more pressure, but this side has more pressure. So it's a cross. That does happen. It just tells us that you have a different kind of problem. Okay. All right. So this one, people don't realize it until we point this out to them, which is when you are walking, do you notice that one arm is swinging more than the other? Okay. It's really good for you to have someone take a video of you walking. It will show you a lot. So I'm going to play this and you will notice that the right arm is swinging a lot more. So that tells us that her rib cage is twisting more on one side, but not so much on the other. So these are things, again, that exist even after surgery. And if you just address these things, you're going to realize that your surgery was actually successful. All right. The other one is sacroiliac instability. Okay. So this is a classic symptom of iliac instability. If you sit for a while, maybe 30 minutes or longer, and you stand up, standing up hurts, or you feel stiff, and then somehow the first few steps are painful, and then it gets better or easier. That is not your disc. That is not a pinched nerve. I promise you that is your SI joint. There are several explanations for that. Some doctors will say, oh, that's blood flow. Your joints started to warm up. But the reason that we insist that this is the problem is because we can get rid of the symptom once we stabilize the SI. So that tells you that that is a problem. So this is a very good way to test. I'm going to play it. And it will be hard for you to test it. So the testing here is to stare at the ankles and you lie down on your back. And then while someone is looking at your ankles, you are going to sit up. Now, when you sit up, you're more than welcome to push up with your arms. Okay, if you can't just sit straight up, it's okay. This is not a strength test. This is an SI test. So you can use your arms and to sit up. And then once you're done there, you are gonna lie back down again. And it's always best to test it once or twice, preferably twice. And you're really gonna notice that this area is going to shift. So I'm going to play it so you can see it. All right, so the volume is actually on, but I'm going to play it again, and I'm going to narrate what happened there, okay? So hold on, I'm going to go back to that, and I'm going to play it. So what's happening here, you'll notice that the foot that was shorter became longer. And then once this person transitioned again to lying down, you'll notice that it became shorter again. So there is a shift as the person who's lying down came to a sitting position and then laid down again. You will notice that one leg becomes longer and then it becomes shorter. Or sometimes it becomes longer and then it becomes even, or it becomes shorter and then it's even. We are not testing your feet. We are actually testing this. This is your SI joint. The green part is called the sacrum. And the one that attaches to the green part is called the ilium, which is part of your pelvis. So that's where the SI comes from. Now, when you look at it, it's just two bones that are stuck together. So when that joint is unstable, the big bone on the pelvis, the ilium, is going to shift because it's unstable. If it shifts back, then the leg becomes shorter. If it shifts forward, then the leg becomes longer. That's why we test you down the feet. Now, there are other tests out there for it, but I don't believe in doing a test that causes pain. So this one is a painless type of testing. That's why I prefer this. All right, so that can be stabilized with 5 muscles. All right, so the next one, this is a very common issue for people who have had knee replacements, yet they continue to have pain. And this is tibial torsion, okay? So tibial torsion is very easy to test. You find the kneecap and you hold it on each side, on the sides of the kneecap, and then you trace the shin bone and go all the way to the very top. And it's going to create a triangle. And if you notice that the bottom part seems to be a little bit too far out or too far in, that means that there is torsion. Okay. Now, it's not necessarily perfect, but the closer you are to the triangle, the better it is, the better the alignment. So it's either perfect or it's slightly to the side, but it should not be extremely out to the side. What this really means is this is about the relationship of your thigh bone to your lower leg bone. And sometimes there is a twist and that creates a misalignment. So they may have fixed the knee replacement itself, but if the bones are not aligned, you are going to overstretch or stretch or stress the structures that are attaching to the joint. Once you derotate that, it will literally realign itself. So that can be realigned in one session. There is a muscle up above in the thigh that we need to release. And then there are also muscles, not the calf, but what's below the calf. We release those and that will realign this joint. Like I said, muscles move bones. So when you recognize which muscles are the culprit and you move them, the bones should move and realign itself. Now, these are examples of what you should look out for. Let's say you've had your surgery and you're still having pain, and the doctor says, well, the surgery itself looks great. Well, I want you to look at everything else but the surgery site, or where the pins are, where the new hardware is, and it will speak volumes for you, okay? And so, for example, this picture right here, this x-ray. So this is often what's overlooked. And if you can become your own advocate, you will realize that these are now the problems, not the one that the doctor did, okay? So here, if you look at this x-ray, you will notice that the left side, you'll notice it says L in the bottom, so that tells you that's the left side. If you look at the rib cage, the left side has a lower rib cage, or lower, right? It's the rib itself is kind of lower and more angled. And the other thing is, if you look at the pelvic bowl, so the bowl is, you know, you have those two bones on the side, and there's this kind of a circular thing. You will notice that the pelvic bowl is actually facing right in this space. So for this person, she may have had the spine surgery, but her body is still tipping to the left. So it's still going to be a struggle for her. There's nothing wrong with the spine now, but her body is still tipping. Once you correct that, you'll notice that it will give you so much relief. Okay. The next one, this is after a cervical spine surgery. Okay. So you will notice, again, there is an L above that tells you that's the left side. Look at the clavicle. On the left side, it's slightly higher than the other side. So what that tells you is, yes, the spine had been fixed, but she was still tilted. So that needs to be corrected. There's another thing that I noticed there, which tells me that the ribs on the right side is a little bit more curved than the other. I don't know if you'll notice it, but it's just telling me that the rib cage is rotated at the same time, that it's tilted. All right. So now for the hip replacement. When you're looking at this, if the doctor says everything is good, surgery was successful, it's in place, it's in the right place, and you are saying, but it still hurts, and I'm sure it's in my imagination, it still hurts to walk. My advice to you is to look at the x-ray, not focusing on the joint itself, but look at everything else but that joint, and it will tell you so much. So in this one, you will notice that the right pelvis is higher, okay? And the right pelvis is also wider. And then when you look at the, it's called the obturator foramen. It's kind of like there's eyes, like right in the pelvis area. There's like holes, that's called obturator foramen. You are going to notice that the right one is smaller, okay? And the left side is more rounded and bigger. So let me interpret that to you. What that means is the fact that your pelvis is wider on the right side, that means the body is actually twisted to the right. Because if somebody takes a picture of me and my pelvis is to the right, this would look wider than this one. This would look narrower. Now, as far as the obturator foramen, the smaller hole tells us that that side, in this particular case, is the right side. So the right side, this side right here, it's actually tilted forward, because when the pelvis is tilted forward, the obturator foramen is going to look smaller and sort of oval-ish, okay? Now, on the other side, it's got a bigger hole on the left side. That tells us that the pelvis is actually tipping back. So in this picture, not only is the pelvis turned to the right, but this one is tipping back and this one is tipping forward. You address those because there are specific muscles that create that look. Your pelvis becomes neutral. You're going to find out that this is actually a successful surgery. Now we're on to pelvic rotation based on somebody that has a knee replacement. So again, like I said, don't focus on the actual joint. Look at everything else but the joint space. So in the lower leg, you are going to notice there's two bones, and between the two bones, there is a wider gap on the right side and a narrower gap on the left side. What that tells you is the pelvis is actually facing left. Now, if the pelvis is facing left and somebody takes a picture of it, you are going to see the two bones when they were x-rayed, and the other one, it's not because of the position. In other words, the position of how the picture was taken is actually why you see the separation. One is narrower and one is wider. Okay. All right. Next one. So these things, if you just look at the x-ray, but not looking at the actual joint, but the ones around it, it's going to tell you so much. All right. So what we find always is that the surgery is often successful, but your body is still lopsided. And so that is why the pain is still there. Once you correct the lopsidedness or the imbalance, the body will be capable of what it's designed to do: stand, sit, sleep, walk. And so when you recalibrate the body and you make it symmetrical, in other words, if I split the body in half, and if this star now works the same as the other side, it will shut off the alarm system, because as we know, pain is just an alarm system. It's the body's way of talking to you that something's wrong with it, that something is not capable of what you're asking it to do. So by, again, recalibrating, you get to shut off the alarm system and you find out that the surgery was actually successful. And we find that a lot of our patients will experience that. So now, these are, I'm not going to go into details about these, but I just wanted to give you some samples of the biggest culprits that are creating this. So these are the muscles behind the lopsidedness. So the big one is called the QL, quadratus lumborum. That is the short one, and it connects the rib to the pelvis. When that is a problem, it will create a shift. And if you remember, that is one of the things that we look for. This very long muscle that is called the multifidi, you notice that it starts from the sacrum and it literally goes up to your neck. That will make a twist of the body, and it can really create havoc in different levels. So we do address that. And then the next one is, these are examples of the muscles that are problematic. And the one thing I want to emphasize is that the problem muscles on the right are not the same muscles on the left. In other words, they're different on one side compared to the other. When trying to realign the body. So I hope that's not too confusing. My take on it is the body is like a Rubik's Cube. And so when you correct one, when you move the Rubik's Cube, it changes the others. So in other words, when we correct one part of your body, it will change the way you function, and it's going to expect more from the others. So then we chase those. And then once those are corrected, it's going to ask the other body parts to do better. And so the classic process is that the pain is actually going to move around, and we just chase them wherever they are. And so that's why body recalibration is holistic, because you are connected from head to toe. Okay, you're not just a shoulder or a hip, you are one piece, and each body part affects the other. So you should be treated as a whole. So these are examples of muscles that are problematic. So you can see that on one side, they're different than the other. And then here's another example of those. Like I mentioned earlier, pain is not the problem. It is just the guide. It is the alarm system that we're trying to shut off. So it leads us to where the problem is. Now, why does it lead us to where the problem is? You're going to notice here that there is the yellow and then the orange, right? The yellow is the attachment. The orange is the floating part of the muscle. So you've seen me in the past where I demonstrated, let's say this is a muscle, and the yellow is where I'm holding it and where the attachment is in your scalp. The middle part is floating. So if that muscle happens to be tight, it is going to tug. So if it tugs, where is it going to hurt? At the attachment, right? Because it's tugging. That is how we know which muscles are the culprits. And so once we let go of that and relax, it should feel better. That's why this treatment called the body recalibration method is very predictable. There's a certain expectation when we do something. And that is not because it's too good to be true. It's just understanding that if a muscle is tugging, it's going to hurt, and you release or relax that, it lets go, it should feel better. So there should be a change with every session. Okay, so another thing that I want to emphasize, especially people that have had chronic pain, if you have bladder and bowel function, I want you to know that is part of your muscular lopsidedness. Okay, so a good example up at the top, when we talk of core, we always talk about this being core. This is only part of the core. The top part of the core is your diaphragm. The bottom part of your core is your pelvic floor muscles. There's 4 of them. This is the front of the core, your obliques, and then the back of it is that muscle that I showed you that is very long. Okay, so picture that your rib cage is tilted and rotated. Now the diaphragm sits right below your rib cage. And so if the rib cage is tipped, now the diaphragm can't function. That's why when you laugh, you leak. So you correct this, and then you correct the pelvis. If you have bowel and bladder function, it is going to help you greatly. So if you're frustrated about that aspect of your life, just know that we can also help that given the right problem. Okay, so now I just want to give you examples of how we recalibrate the body, okay? And the one thing that I want you to note is that with the before and after, you are going to notice that the patients are wearing the same clothing. Why? Because these changes happen within that hour. Because we treat patients for an hour, and at the end of that hour, we see the change, okay? This is a very good example of what I said. Muscles move bones. So if we correct the tight muscles, it should make the needed changes. Okay, so here's the first one. So you notice that this gentleman is stooped forward and also leaning forward. And then at the end of the session, he is straighter. Now, interestingly enough, when people have a stoop posture, most of the exercises that are given by therapists or athletic trainers is to squeeze the shoulder blade together, right? Like that. And then do some chin tucks. That's the thing. But really and truly, the hips are what makes you straighter. So in other words, if I'm stooped like that, and if I make an effort to push this forward, you are going to notice that the rest of me up here is actually going to be straighter. That is, again, a good example of treating the body holistically. How is the body designed to function? That is how we accomplish this. We actually lengthen this part. We didn't do anything to this part. And you can see that within an hour, he was able to stand straighter. The next one, okay. I gave this as an example earlier. You are going to notice that the body was leaning over to the left so that you can see more holes in the chair on the right side, okay? And then less holes on the left side. And after the session, you notice that now you can see more holes on the left, which essentially just means that from tipping over this way, we just straighten the body so you can see what's in the back of the chair. That's all it is. Now, next one. Okay. So this is an example of a case of hyper flexible body versus hypo flexible. So on the left side, you can see that this lady can twist a lot. There's a great range of motion here. But on the opposite side, she's limited. Okay. So how do you solve this problem? Most people will think, oh, the left side, her ability to turn to the left is normal, and the right side is the problem. The answer is both of them are problems. Turning to the left in this case is hyper flexible, and the one turning to the right is hypo flexible. And so the way to solve the problem is you limit the range of motion of the left, and in the process, you allow the body to turn to the right. And again, because we did that, you will notice that now she's able to turn right and left more symmetrically. And again, pointing out that that is something that happened within an hour. All right, next one. So this one right here is people who are tipped to the side so that when you're tipped, one ear is going to look like it's higher than the other. A lot of people with neck issues will have this. Sometimes they will have dizziness, TMJ issues, headaches, and you can see that afterwards we corrected it, the body became neutral, and therefore the ears are level. Next one. I gave this as an example earlier about the weight bearing issue. So on the left side, you can see that the feet are asymmetrical. And again, you notice that the left one had more range of motion. On the left side, if you look at the left picture, the left foot has more range of motion and the right foot was actually limited. And on the right side afterwards, you can see that the right foot range of motion increased, and then the left foot actually decreased, and in the process, they are now symmetrical. So another takeaway I want you to get is that just because you are very flexible does not mean it's a good thing. In fact, with chronic pain, a lot of the issues is hyper flexibility, because when you are hyper flexible towards one side, you compromise the other. And so it highlights the difference between the two. So if you look at it from that standpoint, you can correct it accordingly rather than be proud of the hyper flexibility, and in the process, you become symmetrical. All right, another example of somebody whose trunk is shifted to the left. You can see more space on the back of the right side of the chair. And then at the end of the session, she is more equal. All right, next one. This is about the hip shift. The hips were shifted to the left. And at the end of the session, it's more equal. And again, please note, the lady was wearing the same clothes. This one right here, another case of hyperflexibility. This is someone who is kyphotic, so kind of like that, okay? So because of that, you will notice that before he could go way up, but because he could go way up, he couldn't go down so well, okay? And so we worked on him, and you notice that at the end, we limited the hyper flexibility towards that direction. And in the process, we minimized the kyphosis. So we were working on that posture. Okay. And this one, I think I've already shown this, but anyway, if I didn't, if it was the after, you'll notice that again, the body was leaning to the left, and then it became more equal. You can see it in the back. All right. This is also another common problem where when we ask people to crisscross applesauce, that means you cross your legs, and people will say, oh, there's no way I can do that. And that's exactly what this lady said. She couldn't do it. She said, I have not been able to do it for as long as I can remember. Now, what we did was just allow the pelvis and the rib cage to move. And because we did that, then she was able to assume this position after, which tells us that there was far more greater mobility in the pelvis and the rib cage area. Again, notice it happened in an hour. All right, now this one right here, I don't know if you can see it. On the top part, the pelvis was actually facing left. She was always confused why she felt that her right buttock was smaller than her left, and not realizing that the pelvis was just facing left. So if your body is facing left, it would appear that the left butt is bigger and then the right bum is smaller. And she wanted a bigger one. But what we did was we just leveled the pelvis, and in the process, she got both buttocks equal, and she was happy with it after. The next one, okay? So you can see here that there was a rib cage problem, and so we corrected the rib cage. And so instead of it being humped over on one side, there was scoliosis here. We made it more even afterwards. And this one is someone who had limited ability to extend the body, okay? This is a case of this is a case of hypomobility. There was a limitation of motion there. And so in the process, we worked on the front, and then she regained. So this is, if we're talking about fascial line, we worked on the front line, and in the process, she regained a significant range of motion. And so that allows the body to function more normally. Okay. Now this one, the rib cage is facing left, or was facing left before. You can see that the right shoulder was slightly forward, the left shoulder was slightly back, and then at the end of the session, she was equal. In other words, her rib cage was facing that way, and then we moved it again on that same day. And so what is next? The reason that I wanted to give this workshop is to give people hope that there is a solution to get significant pain relief even after what you consider is a failed surgery. I don't give people false hopes. Believe me, if you have these problems and you take the time to address it, you will get at least 50 to 75% relief. Imagine what life will be like. How active can you get? What kind of sleep are you going to get? You will be able to travel, right? Now, we don't guarantee 100% pain relief for obvious reasons. We're only working on muscles. There might be some structural issues that get in our way, but most of the time, when our patients do get to the wellness point, or to the point of doing maintenance, because some people do choose to do that, we have patients who do become completely pain-free. We just can't promise you that right from the get-go. Okay, so what are the next steps? If you are still skeptical, I highly encourage you to reach out to us. The physical therapist, Dr. Myra, and I are usually, we would be happy to be on the phone with you for 30 minutes, if not an hour, whatever it takes to make you understand. Those tests that I showed you, we can do that on the phone. We'll just guide you step by step, and whatever you tell us, we will interpret your specific problems. Now, if you prefer a telehealth session, this is a free session, by the way, the phone consult or the telehealth, just to make you understand what we're looking at. what your body looks like. That again, like I said, is free. Now, if you're not sure if we're the right fit, this is the majority of what people do. They take advantage of our 50% off a fascial recalibration treatment. So that means you can come in and do a session with us for 50% off, and it comes with the money back guarantee. If at the end of the session you don't notice a difference, you're disappointed, you're not happy with the whole thing, you can walk away from here, not pay a dime. All you've lost at that point is your time. But like most people who have been to see us and who have been successful in regaining their active lifestyle, they always say there is nothing to lose, right? If you've exhausted everything and you are still in pain, it is worth looking at it from a different approach. There is absolutely nothing to lose. And like I said, we hear that time and time again. Lastly, this is for people who have heard of us through their friends and family members, because fortunately for us, we have a huge word of mouth referral. So if you already know us, or you feel like, you know what, this is it, you are ready to move forward and give this specific or this revolutionary approach. That's a quote from a patient. If you want to give this a shot to make a huge change in your life and the quality of your life, schedule an evaluation. So I urge you to take one of those 3 steps, and we hope that this workshop has been helpful and that you're able to recognize your problems. Like I said, if you recognize those problems, don't just shrug it off and say, well, no one's perfect. An analogy that I always talk about is when you have a car with misaligned wheels, why do you realign them? Because the tires are going to wear out unevenly if you leave it alone, right? So why is it that when we recognize that we are misaligned, we ignore it thinking no one's perfect? Just like the wheels that are going to wear out unevenly, your body is going to put more stress on certain parts of you compared to the others. And that is why you end up in pain, which, by the way, that is the 8th part of our assessment. It's called biomechanical problem. So biomechanical problem is talking about the root cause of the problem. Okay, so the root cause of the problem is never ever in the area of pain. It's always somewhere else. That's just how we're designed. So the talking about a car again, I tend to like giving cars as an analogy because people can really resonate. It resonates with people, right? So the other thing that you can look at is, you know, when you have aches and pains, we tend to ignore it until it gets worse, and then we panic, and then we do something about it, and at that point there's no more problems. But if you look at how we treat our car, the moment there is an engine light that goes off or that goes on, what do? We take it to the shop because we are worried that, you know, something's wrong with the car, and so we have it fixed right away. Well, your pain is an alarm system. That is your engine light that's going off. So you need to pay attention to it because that is your body telling you something's wrong with it. And if you nip it in the bud, then the chances are your problems are going to remain smaller. But since this is about failed surgeries, very likely, I call it the onion is big, right? So we have to peel the layers. But the thing is, we can still peel it no matter how big it is. We can still make a difference. We can still transform people's lives because really and truly, that is what we do. By recalibrating the body, we can transform people's lives. So I hope you reach out. Looking forward to hearing from you.